Respiratory system, you always want to know the functions of any system that you're studying. Well, it does gas exchange. Oxygen and carbon dioxide between air and the blood. It helps with speech and other vocalization, helps with smell, helps control the pH of our body, aids in regulation of blood pressure by assisting angiotensin II production, helps create pressure gradients for flow of lymph and venous blood, and its expulsion of abdominal contents, defecation. So if you look at the divisions of the respiratory tract, conducting division, passages for airway without exchange of gases. You have the respiratory division where gas exchange takes place. So the conducting division right in here, okay, and then the gas exchange takes place in the lungs. So your upper respiratory tract is basically your nose all the way down to the larynx. They usually say anything below the glottis, which is right here, is your lower respiratory tract. So just to kind of reiterate, when you sneeze, you're sneezing to clear the upper respiratory tract, and you cough to clear the lower respiratory tract. Fun facts from Papa Patel. All right. Respiratory involves 4 processes: pulmonary ventilation, breathing, movement of air into and out of lungs. You have external respiration, exchange of oxygen and carbon dioxide between lungs and the blood. So that's the respiratory system. The circulatory system, well, it transports your oxygen and carbon dioxide into the blood. You have internal respiration, where exchange of oxygen and carbon dioxide between the systemic blood vessels and tissues occur. So that's how the respiratory system and the circulatory intertwine and work together. Okay, so again, respiratory system is pulmonary ventilation, which is breathing, and external respiration, exchange of oxygen and carbon dioxide. The circulatory system then transports that oxygen and that carbon dioxide. Again, the upper respiratory tract is the nose and nasal cavity, paranasal sinuses, the pharynx. Sometimes the larynx will be included in the upper respiratory, but the take-home message is anything below the glottis. So the glottis right about here. So you see how the larynx goes here and here. So anything below this, that's why the larynx is cut in the middle of, is it part of the upper or the lower? The trachea, the bronchia, and the lungs are part of the lower respiratory. So you're coughing to clear the trachea, the bronchi, and the lungs, and you're sneezing to clear the nose, paranasal, and pharynx. Here's a close-up view. You have the conchae, remember this? The nasal conchae, superior, middle, inferior. You have the guard hairs right here. So remember, don't pluck your nose hairs. Trim them. Here's the hard palate. The hard palate separates the nasal cavity from the oral cavity. You have the soft palate and the uvula. That's that little punching bag that you see when you open your mouth. And here are those palatine tonsils that some of you may have them removed if they get infected. Remember, they're part of the lymphatic tissue, and they can get infected. All right, here's the tongue, the lower lip, the mandible. Here's your vocal cords, and here's the trachea and the esophagus. So respiratory system, GI system. That's why if you swallow your food too fast and the epiglottis fails to shut, then the food can go into the trachea and you can choke. You'll cough, and you might have to have the Heimlich maneuver done on you, where they expel that food and then it launches out. Okay, so here's that auditory tube or eustachian tube, pharyngeal tonsils. Okay, and here's the breakdown of the nasopharynx, oropharynx, and laryngopharynx. All right, so if you look at the nose, warms, humidifies, and cleanses air, detects odors, resonates the voice. Okay, root, bridge, dorsum, nasofascial apex. Okay. Externally shaped by nasal bones and alar and lateral cartilages, from the nares to posterior nasal apertures, vestibuli, which is chamber outside the nostril, nasal septum, septal cartilage, vomer, perpendicular plate, then superior, middle, inferior nasal concha. Look at this. This is all repeat. Remember all that from the first 2 weeks of class? Then you have olfactory and respiratory epithelium that line that. All right. Okay, remember, I might have shown you this picture already, but let's look at Michael Jackson throughout the years and how he's had those nose jobs. You know, again, I always say, good-looking guy here. I'm not sure. Even here, decent, good-looking nose. And then he started getting weird. It's here. Just got smaller and weirder, and then it just like almost disappeared. Now, does this affect his breathing? Of course it affects his breathing, right? You mess up with the mucosa, you mess with the hairs, this can definitely affect him. He can be more prone to viruses, there's all sorts of things. Look at his nails too, all sorts of issues with his nails. Those aren't healthy. So, poor guy, you know. All right, the pharynx throat has 3 divisions. The nasopharynx, posterior to the conae and the soft palate, houses the pharyngeal tonsil. It's lined with pseudostratified epithelium. The oropharynx, posterior to the root of the tongue. Entry from mouth is through the fauces. That's lined with stratified squamous. Now remember, stratified squamous is meant for abrasion. So you can, some of the things that you eat, it's going to be very abrasive. Perfect example is I had a patient, it was a year or 2 ago. He was eating Doritos, and the sharp edge of the Doritos basically cut his esophagus because, I don't know, maybe he didn't swallow it correctly, or he didn't bite down or chew correctly. But anyways, it cut his esophagus, and really, so he ended up suing Doritos, of course. And then I think if you notice that the edges are a little bit more round now. Crazy people. So be careful with those tortilla chips. Guac and chips. Guac and chips. Miss that. All right. Laryngopharynx, from tip of the epiglottis to the esophagus. And again, that's stratified squamous epithelium. So if you look at the larynx here, the voice box keeps food out of the airway with epiglottis. Has several prominent cartilages, including thyroid cartilage and anterior aspect. Inside houses vocal cords and vestibular folds. So here's the laryngeal prominence. This is the Adam's apple. Here's the cricoid cartilage. Here's the trachea itself. Here's that hyoid bone that we've talked about many times. And here's that epiglottis that must shut. Here's the epiglottis that must shut when you swallow, so that food goes down your esophagus, not your air pipe. Here's cricoid cartilage, or arytenoid muscle, but then there's the arytenoid cartilage as well. You have vocal cords. You have corniculate cartilage. Again, this is all cartilage. Okay. You have thyroid cartilage here. You have a little bit of fat pad here. Okay, but the larynx is mostly cartilage. So you have to know all the parts of this little guy right here. Okay, so again, this is the Adam's apple. Laryngeal prominence is the medical terminology for it. I think in class I mentioned, hey, if you go to Vegas and you see a good-looking gal with a scarf on in 120-degree heat, you may want to look into that and say, no thanks. Well, here's, remember our friend Bruce Jenner? Well, look, he's got a very prominent laryngeal prominence here. So one of the first things that he did during the transition to Caitlin was to have that shaved off. So you see that is no longer there. So you can see the scar actually right there where they went in and shaved that off. So there you go. That's why when they do usually a sex change operation, one of the first ones, the cheapest ones they can do is that, and that's their transition right there. Obviously the breast augmentation is usually next. Sometimes the nose job is next while they're transitioning, but the laryngeal prominence right there is usually the first one, and then the breast implantation is next. All right, some fun facts. Our respiratory system is made up of many organs that work together like musicians in a symphony to make us breathe. Let's get started with the respiratory fun facts. Every minute we breathe, we take in 13 pints of air. That we breathe about 6.15 liters of air every minute, and we breathe about 9 to 20 times every minute. Through every breath, we breathe in about half a liter of air. So here's the vocal cords. If you look down at it, yes, these are the vocal cords. Here's the base of your tongue. So see how your tongue is attached here to the epiglottis right here. Here's the vocal cord. Okay, here's the glottis. Glottis is an opening. Okay, and then here's cartilage here. So the ability to adjust the tension on this is what makes Mariah Carey so good, and she can pretty much crack glass with her voice, right? So again, just to reiterate, here's the thyroid cartilage, here's the cricoid cartilage, here's your vocal cord that will open and close, shorten and tighten, okay, depending on the pitch. So some of you have a deep voice, some of you have a very high voice. So that's all based on this vocal cord right here. Usually men, due to testosterone, will get a deeper voice as this becomes thicker. Okay. Arytenoid cartilage, corniculate cartilage. Okay. So is this really possible? Can you sing and shatter glass? Of course, absolutely. So depending on the pitch and the tone, like I said, I think Mariah Carey has her vocal cords insured for about $1 million to $3 million. A lot of singers will insure them because if something happens to them, they can't sing. I think Celine Dion had her vocal cords very irritated because she was singing 2-3 concerts a day in Vegas, and she had to take a break because she developed, I think, nodules on her vocal cords that they had to surgically remove. All right. Here's the trachea and bronchi. The trachea, which is your windpipe, which is right here. Again, here's the thyroid cartilage. Here's the cricoid cartilage. This is your trachea. Tube lying anterior to the esophagus. Remember, it's anterior. C-shaped rings of hyaline cartilage. This is all hyaline cartilage. Trachealis, smooth muscle on the posterior aspect. The carina, internal median ridge on the lowest tracheal cartilage here. So here's the carina right here. And then at inferior end, it splits into two main bronchi. And again, if you look at the anatomical reason, boom, it goes straight here. So most pneumonia and objects will end up in the right lower lobe just because it goes straight down. This has more of an angle, so objects will get stuck right here. But usually pneumonia, bacteria, viruses, objects that kids swallow will end up in the right lower lobe here. All right, like I said, kids are notorious for swallowing objects. Usually it'll go down the esophagus, but there are times when it can go down into the trachea because, remember, their epiglottis hasn't fully developed. That's why kids choke a lot, so you have to be careful. But yeah, watch them kids. So here's a coin that's stuck. Trachea right here. Okay, so, and then this one is actually stuck in the esophagus. So, again, they'll have to pump the stomach, pump something. They have techniques to get this out. What is it? Vega, you work in the GI office, don't you? All right, the trachea and bronchi continue. The tracheal wall, the inner lining, remember, pseudostratified epithelium. You have goblet cells that make mucus. You have ciliated cells, basal stem. You have the mucociliary escalator or elevator that we call it. Remember, smoker's cough. So when you smoke, it paralyzes these cilia and this goblet. So you get the smoker's cough. These little cilia can no longer push the mucus out of the trachea. So in the morning, a lot of times the patients will have that dry cough trying to get rid of that phlegm that's developed because their mucociliary escalator has been hindered due to the nicotine and tar. So don't smoke. Adventitia is the outer layer of connective tissue connecting the trachea to the neighboring organs here. Lungs, again, you have 3 lobes on the right, 2 lobes on the left. Superior apex, inferior base, costal surface, mediastinal surface. Okay. The hilum is the slit right here. Okay, the hilum. The root, bronchi, vessels, and nerves. Left lung has cardiac compression with a notch. So here's that cardiac compression because the heart kind of sits right in here. Okay. So here's the mediastinal surfaces. Okay. Lobes, again, the left has 2 and the right has 3. Right lung is slightly larger than the left. Hairs of the nose help to clean the air we breathe as well as warming it. The highest recorded sneeze speed is 165 kilometers per hour. The surface area of the lungs is roughly the same size as a tennis court. Capillaries in the lungs would extend 1,600 kilometers if placed end to end. We lose half a liter of water a day through breathing. It's the water we see when we breathe on a glass. And a person at rest usually breathes about 12 to 15 times a minute, and the breathing rate is faster in children and women than in men. Look at the histology of the lung. Here's the little alveoli where gas exchange takes place. Here's the bronchial mucosa. Here's the bronchial and the alveoli. So the bronchial tree, the primary bronchi, the right main bronchia is wider, more vertical than the left. That's why it can house coins and marbles and all sorts of things that kids can swallow. But then viruses like the right lower lobe as well. Secondary lower, you have 5 total, 1 for each lobe. And then you have a tertiary segmental bronchi. They serve bronchopulmonary segments, 10 in the right and 8 in the left. All bronchi are lined with ciliated pseudostratified columnar or pseudostratified ciliated columnar, either way. Bronchioles are 1 millimeter or less in diameter. A bronchiole ventilates a pulmonary lobule, and each bronchiole splits into over 50 terminal bronchioles. So increase the surface area. So then you get gas exchange that occurs right here in this alveolar sacs right here. Okay, so on the quiz or anywhere, if anybody asks you, gas exchange takes place at the alveolar sacs. One alveoli is big, and the alveolar sac is one of those. Okay, so alveoli are multiple alveolar sacs. Alveoli, squamous, type 1 alveolar cells. Okay, 95% of surface area. Respiratory membrane is site of gas exchange, consists of type 1 cell and capillary cells. Okay, so great type 2 alveolar cells, that's 5% of the surface area. Outnumber type 1 cells. Produce a surfactant, which is important in the lining of the lungs so you can breathe without pain. Repair alveolar epithelium, and then there's also alveolar macrophages, which are dust cells that help kind of get rid of dust and bacteria and anything that macrophages want to gobble. Remember, macrophages are our second line of defense. Not selective, okay, but they just kind of, anything that comes in there, and macrophages will gobble up. But if you look at this, here's air, and look, the air is bringing oxygen into the blood, and guess what? We're actually having an exchange of carbon dioxide back into here. So you're going to breathe out this carbon dioxide, and then as you breathe in, you're bringing oxygen to the blood. So that's how gas exchange takes place in the alveoli. The pleura, visceral pleura on the lung surface, parietal pleura on the inner surface of the rib cage. The pleural cavity is the potential space between the visceral and parietal pleura, contains pleural fluid. Again, the pleura reduce friction with respiratory movements, create that pressure gradient, attaches lung to thorax wall, so that thorax movements change during lung pressure. And its compartmentalization prevents spreading of infections to or from nearby organs. So we'll talk about that with TB. The most important muscle of the respiratory system is the diaphragm, which is the primary mover of pulmonary ventilation. Contraction pulls it down and enlarges thoracic cavity for respiration. Relaxes for expiration. So I think when we were doing muscles, I told you that if you see someone with a forward head, rounded shoulders, tell them to relax and breathe out. As they breathe out, this diaphragm will dome and all these muscles will just relax. So every once in a while, take a deep breath in, but then exhale, exhale, exhale. Okay? Look at all these muscles that do inspiration. Sternocleidomastoid, scalenes, external intercostals, pectoralis minor, internal intercostals, diaphragm. So if you have tightness in your pec minor, you might be breathing out. And then really there's only a few muscles that do expiration, and that's the diaphragm. So imagine if all these muscles are breathing in, breathing in, breathing in, and this guy is fighting against it, the diaphragm will get tight. If the diaphragm gets tight, then all your low back muscles can get tight. So it's a vicious cycle, and the way to combat that is breathe out. Take a deep breath in and breathe out, breathe out, breathe out. So breathe out twice as long as you breathe in, and try that. Respiratory neuroanatomy. Respiratory centers are the medulla and the pons. You have the ventral respiratory group, VRG, primary respiratory pacemaker. You have a dorsal respiratory group, the DRG, signals the VRG to modify breathing. And then you have the pontine respiratory group, which is the PRG, that signals the DRG and the VRG to modify breathing. So again, this is more physio, but this is, at least you know that, hey, this takes place in the medulla and the pons. Again, you have chemoreceptors, central chemoreceptors, the brainstem neurons that respond to pH of cerebrospinal fluid based on oxygen, carbon dioxide. You have peripheral chemoreceptors, which are neurons in the wall of the aorta and carotid arteries that respond to pH, oxygen, carbon dioxide content of the blood. You have stretch receptors in the respiratory system in your lungs. You have irritant receptors, say, hey, you've got some dust in there, and then you have higher brain centers such as the limbic system, hypothalamus, and cerebral cortex. So all these receptors, chemoreceptors, and input centers monitor your rate of breathing and say, hey, is there an emergency or not? Again, the respiratory centers in the central nervous system. You've got this in the pons. Here's the DRG. Here's the VRG. Okay, and then here's the PRG. So this is all setting your respiratory rate. It'll go higher or lower depending on what it perceives as threats or not. Again, you don't have to think about breathing. Remember, your body does it automatically. You can breathe faster or you can breathe slower, but a lot of times your body knows to breathe all the time. The peripheral chemoreceptors, okay. Embryonic development. Fetal breathing begins by 11 weeks. Amniotic fluid is inhaled and exhaled. By 11 weeks, look at fetal breathing begins. First breaths of neonate are strenuous as alveoli must be inflated, right? Taking that first breath, look how small. So 3 months is very difficult. 6 months, the lungs are finally developed there. So if kids are born before 6 months, they're not really likely to survive. Or they'll have respiratory issues for the rest of their lives. Okay, ventilation declines after the 20s. Loss of elasticity in the lungs and thoracic cage. You have fewer alveoli in old age. Elderly less capable of clearing those pathogens, so you get more infections. They get more viruses, bacteria that stay in their lungs. They can't breathe out. And then obstructive pulmonary diseases are more common in old age. Let's talk about those pathologies in the next slides.